Did I just unmute?
Yep, you're good.
Okay, good. All right. Still learning this.
All
right. So it's good to be here. Thank you for hosting me. And thank you guys for taking the time to come to this presentation. I'm hoping that you get some good tools and some other perspectives. When I was asked to present and they kind of gave me free rein, I got really excited because it's a little bit of something I would like that I have put together, and just was waiting for the opportunity. So as he introduced me, I'm trying to see if I could, I wonder if I have to switch this. I'm sorry, the share screen option.
Looks like we're looking at the presentation.
It's not moving. Oh, there we go. Okay.
Oh, there we go. Little delay.
Okay. So he already shared with me. I'm Stefana Johnson. I go by Steph. My history, I worked a lot in residential treatment center, outpatient trauma therapy, at the burn center, and private practice now. And I think probably the best experience that has brought me insight into cultural, what I call cultural incompetence, because we'll get that to a second, is also have been living in Japan I lived there for 2 years. And so going to another country where you don't speak the language, you don't write you can't read, really kind of challenges you beyond your perceived limitations and your reality. So I'm hoping that to bring some of that experience to share with you guys. It'll give you a little bit more insight to be able to work with probably some of the more challenging cases that are difficult to conceptualize. And I heard that it might be a variety of people in this training, whether it be mental health professionals or first responders. So I'm hoping that the information I present is helpful to all. So there we go. Okay, so let's talk about, just start out with culture. Most of us, I've been through a lot of culture competency meetings or trainings, and a lot of times they talk about people's religion, cuisine, language, how they kind of function as a culture, a group of people. And we can learn a lot about different cultures, but ultimately each person really has their own culture. And sometimes trying to lean into cultural competency and understand other cultures can kind of get us pigeonholed into this idea about a group of people, which is counterproductive. And so when I look at that, I look at each person as more of a system. And so one of the things that we don't hardly really get into is everything else that creates the person. And this is where a lot of times people get stuck, I think, in understanding that culture isn't just about these external factors and about, the way people dress, what they eat, how they speak, all of these things, but also the behaviors, how they interact with people, the beliefs about relationships, about what respect is. I learned this whenever living in Japan here, we were taught to do eye contact and shake people's hands. And over there, it's disrespectful to do eye contact and shake people's hands. You bow down and you look at the floor. And so all of these things that I didn't even realize were so ingrained in me all of a sudden became wrong in this completely whole new world. And a lot of times there are individuals here, even in our country, or people that we work with that see the world differently and experience the world differently. And this is where a lot of, where people might get offended over how some people function or interact, because we all have our own interpretations of behavior. We all have our own interpretations of what it is to be respectful or to be cognizant of others. And so this is where a lot of limitations come in, particularly when it comes to therapy and providing services for clients and for patients and for anyone who deals with the public. And probably all of you have experienced a point where you meet someone or you're trying to make sense of their behavior or the things that they do, and it just causes stress because you're thinking, why would anyone do that? And so that's kind of what I want to get into today, is get a little bit deeper into culture and understanding how that even is formed, and what do you do to deal with that, to navigate through that. The word competency itself is defined by the ability to do something successfully or efficiently. which is really hard when it comes to some cases or individuals where you just don't understand how they function, why they function that way, their behaviors, beliefs. And it's really hard to assess very quickly. We tend to take shortcuts and we associate with what we know, which then puts our lens on situations. So this is one of the biggest blocks when it comes to providing services, to interactions, and to communication with people, being effective at communication. So in the mental health field, we call this block, we might end up labeling the client as treatment resistant or very challenging. And I would challenge that to say, really, is it them or is it us, right? And our expectations and our perceptions of things. And so hopefully this is a question you can kind of sit with for a second. So my first question, when I think, if I was to meet you and I asked you, who are you? What are the first things besides your name? You might give me your name, but what are some things that identify you? So would you tell me what you do for a living? Would you tell me about your family? I might say, okay, I'm a wife, I'm a mother, I'm a therapist, I'm a Hispanic woman. This whole concept that sometimes we don't even stop and consider about how we perceive ourselves, about how we view our abilities, our challenges, our weaknesses or strengths. If you were to be in an interview, like, what are some things you would share about yourself? This is just a question to kind of ponder on how we perceive ourselves, because we also, not only that identity, but with that comes all these rules and all these beliefs about what it means to be that. So how do we even form our identity? And not to get to, I know that we have a variety of people here, but if you're looking at even Erickson's stages of development, from the time that we're born, we start forming our identity. I always say we all come in the same way. We're just a little screaming meatball that has needs and is wanting to survive. And depending on the type of caretakers that we have, that what country we're born in, right, what family we go into, we start learning about the world based off of our environment and our experiences. And that starts forming our identity from the moment we come into this world. Now, we don't recall being born, except maybe, I think there's like 10 people that have that memory where they can remember 95% of their life. But for the most part, we can't remember what we were experiencing as a newborn, as a baby, not cognitively at least. Our long-term memory doesn't form until we're almost 4 years old. So a lot of memories, you might have little clips of things, or if you've seen pictures where memories are kind of formed based off what other people tell you about what was going on in that moment. But generally, we don't start recording that information until later on. However, our body also has its own memory. And those are the things that kind of get subconsciously ingrained in us. And this is important because when we're looking at things from a trauma lens, is that oftentimes we want to make sense about what's going on based off of what we're observing and even what the person knows about themselves. And there's so much more to how we function, how we view ourselves, and all of that started even before we were aware, right? So as a child, as a baby, you come in, if you have a parent who is in tune with your needs, this is where the attachment forms. And some of you who are mental health professionals, are aware of the different types of attachments that can form. If there's a healthy attachment, meaning the caretaker is responding to the child's needs, it's teaching them how to connect, right? So a baby starts learning, okay, the first all discomfort, just they cry, but eventually they start connecting. This discomfort means I'm hungry. This discomfort means I need a diaper change, or they start making associations, right? And by the time they're 1, maybe 2, they're able to tell you if they want milk. I remember my daughter doing this for milk. We taught her the little sign language, or if they want their diaper changed. And that's all associations that are created. But some of the research before, we used to think that the long-term memory wasn't formed until the 4 years old. But as we do more and more research on brain and what's going on with development, they're discovering that even babies, the part of the memory, which is the hypothalamus, there's a part right here in the limbic system that helps kind of collect and store all the information of the experiences that lead to our sense of self, it is actually already active, even from the time a baby's, they're an infant, we're an infant. And even though we don't have the ability to reason or for language, because that comes later, we start forming an identity, a sense of self, a sense of the world. And according to Erickson, this is where the trust versus mistrust happens. So if it's a healthy attachment, we might be a little bit more secure. But if we have a parent who is either dealing with their own trauma, or they're busy and have limited time, they don't give us the attention or the emotional, they're not emotionally responsive, either because they're struggling with depression or because they just have issues that are unresolved and they're unable to engage, whatever reasons, it could build a sense of mistrust, rigid thinking, kind of, we get stuck in that survival mode even before we're aware that we're doing it. This is kind of the subconscious. So I want you to think about it as like the body memories that get stored. Then as we get older, from 18 to 2 years, 18 months to 2 years, we start learning what we're capable of. So if we're able to walk and, the parents are like, yay, kind of encouraging us, we might build some confidence. But if we are in a situation where there is uncertainty, like domestic violence, fighting, stress, kids tend to internalize, right? We feel like lack of control, lack of safety, and it could lead to doubtful, we don't have control, or, doubt our abilities. And this impacts us way long-term, even beyond the time that when we have more ability to impact our life. And so these are the things that start forming. If you look at the little Russian dolls, I feel that it's a perfect analogy, because it's like this little person, whatever you experience as a baby, it doesn't just go, it's always in you. And it's kind of a reference point as to your perception of the world and how you grow. And if you put the other doll on top, the body starts growing, but sometimes we get stuck in some of these stages where we don't develop these skills, and it affects our functioning later on. And as we go through the age and we're progressing, right, 3 to 6 years, that's where you're able to start figuring out how to set your own goals and take control without impeding of others, because of course the parents are there to kind of build those boundaries, right? And again, this is something that can impact how we grow, how we view the world, how we view ourselves. Then we go through, as we're getting into pre-adolescence, our self-esteem, whether we feel inferior or we feel capable, our potential, the limitations that we perceive, our perceived limitations. And all of this information is coming from outside of us based off of our experience, what we're observing. So it's both explicit information and implicit information. So we'll get into that a little bit more later. But this is important to know because it's not factual necessarily, right? Because how one person perceives what was going on might be completely different from what another one is experiencing. And as you see us going up, further up the ladder, going into how our relationships form, which could lead to isolation, loneliness, and then our adult self, being able to find a purpose, their identity as in career, whether we become a parent or not, all of these things start developing later, to the point where we get, past 65 or around that age, end of life, we either are able to feel fulfilled and accomplished, or unfortunately, if we have a lot of regrets, that can lead to despair and guilt. The former, the fulfillment and accomplishment really helps us process all of the loss and the tragedy that happens towards the end of life. Losing friends, losing parents, losing friends, all of these things, it can impact how you navigate through those challenges, based on the skills that you've learned throughout your entire life. So it's important to remember this, both for ourselves and the people that we work with. Our experiences are formed not just logically. Sometimes we remember and we can pinpoint, okay, I think this way because of A, B, C, but I want to talk about the subconscious ones for a second, or I would call them unconscious, because when you experience something, our system is built in such a way that the the nervous system, the sympathetic part, for those of you that have gone through like some trauma training or a little bit of information, they call it the lizard brain, that part of us that is the first piece that is developed in our brain. It records information based off of patterns, right? It could be images, it could be sounds, it could be smells, all of those things that it starts associating. But images really is where it holds a lot of the information. And this is important because when we, as a trauma therapist, you know, a lot of times we tend to think that talking about something, logicking our way through, I use logic as a verb there, trying to reason through some of the experiences and figuring out what might have contributed to how we function, sounds like it could be helpful. But unfortunately, when these experiences are subconscious, our brain can sometimes help you forget or suppress some things that were too scary or too big. We're not able to logically pull them up or really make those connections. And this is where we get stuck in development as well, is because when those emotions are elicited, whether intentionally or unintentionally, we might go into this like over response. And these are all memories that are stored. It could be conscious memories that you recall, or it could also be the subconscious one. And this is important for us to know because 90% of our functioning comes from our subconscious. Like we're not always aware of what we're doing or what we're thinking. Unfortunately, that's the number one thing that keeps us stuck in cycles. Think about when you got to work this morning, or if you've ever been behind a car and you're trying to get somewhere and you forget driving there. You just get there because this subconscious kind of kicked in and got you there, but you don't recall, you weren't intentional, you weren't fully present. And that's where that subconscious is kind of kicking in, right? When you brush your teeth, you've done it so much that you do it without thinking. You could be thinking of your shopping list for the day. And so this is important because based on our experience as a child, these are kind of the factors that contribute to how we view ourselves, how we perceive the world, how we function. The other important thing is the interpretation. So it's not just about the experience, but what you got out of the experience, what you interpreted it from that experience. And this is really something that's hard to consider. Like we think when we experience something, we have our way of perceiving. And if you've ever been in a situation where someone else tells a story of something that happened and you were there too, but they have a completely different story or perception on it, this is what happens because of how we are kind of ingrained in our mind. So for example, there's the side, and I use this little like mask right here, right, to say, maybe I come in and I have black hair, you know, my name's Estefana, I'm Mexican, Hispanic, and it's kind of hard to see, I think, with the light probably, but if you're able to see this mask, I don't know if I can stop share for a second. Oh, I don't want to lose it, but the mask is kind of like how we view ourselves and what we see, but what really is where we get stuck is how we interpret inside. So somebody who might go through abuse as a child, it's an experience that they had, but what they interpret from it, I am worthless, I'm a piece of crap, later impacts the way they function, the way they interact with people, their ability to advocate for themselves, boundaries, things like that. If you're in a constant survival state, you in a situation where you had to survive, this is part of your story, what happened to you, but you might internalize it and view yourself as like somebody who's you know, a jerk or defiant or whatever other label might be given to you. And this is where it becomes very difficult to try to differentiate what happened to me from who I am. This is all internal work. But in order to be able to do this, you have to be aware that this is something that you either allowed or created. It's almost like a programming that happens as we grow up. So let's talk about how trauma impacts that. So some of you, it sounds like you've had some trauma training available, but for those of you that are new or don't understand much of how trauma works or what the impacts of that, and I really call it, I don't want you to limit yourself to like PTSD, because PTSD is a very specific diagnosis that the DSM-5 that limits to, specific criteria to meet that. This is just a trauma event. And I believe it was, I'm not going to say the name, I forgot who used this definition, but it's when an event exceeds our capacity to cope. So our ability to navigate through it is where trauma kind of forms. It could cause issues in the long run. So all of us are built with pretty resilient. We can overcome things. We get stressed, and the emotions are meant to be temporary, right? And we all have a window of tolerance. So you see that little window right there of how much we can handle. And as you see the blue arrow that goes down, that's kind of like when we're in a kind of calmer, chill state. If it's a good day, or sometimes it might be a little bit more tired, less engaged. And then as you go up, where the red arrow goes, we're a little bit more engaged. Maybe we're excited about something or nervous about something, or we just are more attentive. So we all have this throughout the day where we're kind of going in and out of this, kind of like little waves. And y'all might know sometimes you're more efficient in the morning if you're a morning person. Some of you are more efficient in the afternoon, because in the morning you just are trying to like wake up, or you need that second cup of coffee before you can function. So we all have kind of this in and out that we go through when we're a little bit more attentive, a little bit less. But when there's stress, one of two things happen. So if we're able to navigate through it and stay in control, later on, we're able to kind of get back to our baseline. But when that stress becomes more than what we have the capacity to hold, and this can happen either because other things are going on in our life, or because it's just a big event, right? Something traumatic, something terrible that happens, then our body can go into hyperarousal, which you might know as fight or flight. And what happens physically is the body then goes into a survival state where its only goal is to survive. And so what happens is our heart rate goes up, our muscles tense up, our breathing gets tighter, all this blood is rushing to our extremities, so our blood pressure goes up. Even your pupils will dilate. If you've ever seen someone who's really extremely angry, sometimes their eyes look really dark, and so the pupils dilate because they're like hyper focused. And the most important thing to know is at that point, our frontal lobe kind of goes offline, kind of like having no internet connection. And what that means is that at that point, our logic, our reason, our whole sense of right and wrong, it goes out the window. And this happens to everybody. This is a normal human experience. And it's not anything wrong with the person. It doesn't define the person. It's just a survival state that happens. And it's important for us to know that, number one, because we all have that threshold. Some of us might have a higher threshold than others because we've practiced, being able to tolerate, but some have a very low threshold. Because what happens when you have a lot of these experiences is that you almost stay stuck in that top part where you're almost constantly on the edge, teetering on the edge of fight or flight. And so it's almost like this window just kind of atrophies. It just shrinks if you even had the opportunity to develop it. Now, the other piece that happens is just like anything that goes into system overload, is that at some point, our system might just shut down. And that's called hypoarousal. So normally, whereas our heart rate when we're calming down would slow down and our breathing gets deeper. Also the digestive system, when we're in that fight or flight, it shuts down. So it re-engages. This is important because you'll know a lot of people with trauma or stress have digestive issues. And so as it goes down, everything is supposed to regulate, but when we go to shutdown mode, it crosses the other threshold, which is that blue line down there, the hypoarousal. And at that point, that's when we just go into shutdown mode. So if any of you have experienced depression, this is where depression is. You're in bed and you just cannot move because your muscles go into a slack. They kind of relax. They just, no energy going into them. And the breathing slows down, the heart rate slows down, you feel lethargic. And the other piece is just like when you're in fight or flight, that frontal lobe also might not be accessible. And so this is where someone who's outside doesn't realize what you're feeling inside and might be like, just get up, put on the alarm. This is what I do. And they give us well-meaning advice, but they don't understand the whole system is kind of shut down. Some people who have gone through a lot of trauma, especially in childhood, and are constantly going in and out of this, it's like their window of tolerance is like a tiny little tightrope. And instead of having more time in the middle, they have brief moments where they are feeling okay. So if you ever had any clients, it's like they have two moods. They have okay or pissed off. That's a good indicator that there was a lot of trauma, that there's probably complex trauma involved. People shut down emotions because emotions become overwhelming. And so we don't have time for that. We're a constant state of survival. And this is really important to know, because at that point, when they're in one of those states, there's no reasoning. And we can also get into those states when we observe someone else, if we feel unsafe, if we're triggered ourselves. And at that point, it's not the time to address problems or issues, or confront someone on what's going on. This is just acknowledging and recognizing where they are.
Really quick
Yes.
stuff. We have a question in the chat box, and it relates a little bit to, I think, what you were just talking about. But Brenda asked, how do you address identity issues when a person has never been allowed to have anything for themselves? In other words, supporting others without having support or knowing what they want.
Yeah, the same way as you would going and exploring a whole different world, a whole different reality. It's I use the analogy of going to live in Japan, right? Because it's a whole new world. Someone who has been in a constant state of victimhood, that has been just beaten down over and over and over again, they tend to internalize and believe that it's them. But unfortunately, we see these cycles where, when you perceive the world that way, you tend to put yourself in situations because you no longer have the ability to assess safety. You don't have the ability, you go from one extreme to the other, trust no one, or just like, it doesn't matter, it's up to chance whether this person treats me well or not. And so recognizing that this is the world that they live in, this is a reality, is the first step. But then introducing possibilities. That means that, just like when I went to Japan, having to learn a whole new language, right? A whole new possibility. And it starts off with psychoeducation on how we got there. Just like what I'm explaining to you guys. Yeah, of course, these are the message. This is how you were programmed as a child. It did feel like you had zero control, because a little 2-year-old, a 3-year-old, they can't just say, I'm out, go get a job and move out on their own. So there's reality. But when you get stuck there, it feels that way even when you're grown, even though you turn 18 or 25 or you're 42 now, and you do have some sense of control, you still feel like you don't. So being able to educate them so that they understand, it's not that there's anything wrong with you, you're just human. And like any human who has experienced these things, of course, these feelings are very valid. These perceptions come from somewhere. But the cool part about being human also is that our brain is kind of like a computer. It can be reprogrammed, right? But in order to reprogram the brain, you have to be aware of the programming. And so being able to observe is really important, to see it from a different perspective, come out of the self and see what where you get stuck and what's going on. And then finding other reference points. I say, if I want to get good at understanding how to manage money, I don't go to people that I know that are just as bad as me at managing money. I go to someone who is where I'm not, and ask them to teach me. Just like you want to learn a new language, you got to find someone who speaks it so they can teach you, right? This requires vulnerability. It requires being open to a new possibility. And it's a scary process. But as a provider, as a clinician, or as a support, whatever role that you play, our job is to acknowledge and realize and see where they are, and then be able to start from where they are and guide them slowly along, right? Because change is hard, but this requires also awareness on our part of realizing, if I'm here and I'm having someone coming from another country, I got to be aware that they don't understand what I understand. They won't know the basics. Like when I went over there, I didn't even know how to properly greet people. I mean, talk about feeling inept, right? Much less ask for my needs. And so you're starting out from scratch. It's possible though, but it's going to take a lot of practice. It's going to take awareness, and it's going to take a determination. But what I tell people is, when you're in constant survival state, that's your entire life. And the goal of life is not to survive until you die, right? If at any point you want to live, it's about realizing that you have the ability to kind of rewrite that program and start. But it takes vulnerability, it takes awareness, and it takes effort. um, so going back to this and the impacts on our perception, when we go through a lot of trauma, when we go through adverse events, it affects how we view the world. It affects our perception, the lens through we view interactions, how we interpret interactions, how we view others. If you know, I worked with kids who had been in gang infested communities, and if you notice how they walk, they're constantly hyper vigilant, looking around, and they're looking at people's faces. They're very hyper aware. And anyone who's walking with looks like even a possibility that they look angry, they view them as a threat. Like, that fool's dogging me is the first thing they would say. I'm like, dude is probably like has a stomach ache or something, you know, has nothing to do with you, but their perception of that, they view that as a threat. And so what do? They go up and confront that individual because they believe in do unto others before they do unto you. And then it causes a conflict, it causes a fight. And here it is reinforced. That perception is reinforced. And so understanding that we all have these lenses through which we view the world based off of beliefs, based off of experiences, is the first step. And then being willing to not react to that, but rather be more curious about what other people perceive or what other person's intention is. We all go through this. And so being able to bring awareness to it is the first step in understanding that perception, because perceptions can be expanded, right? We can open our eyes to other possibilities. Now, the issue with this, and this is where we can get stuck as providers, is that when someone's in this state, their defense mechanisms are up. And that's going to look like fight, flight, freeze, right? The fight means that there's going to be conflict, or we might feel threatened, and it might trigger us to go into that mechanism as well. Flight is like the escape. So they don't, you know, these are the clients you might have that just kind of ghost on you. You have your first, you know, session, or maybe things start getting deep and they ghost, they take off because it's, or they just like try to avoid by changing subject. That's a flight response. It's just being able to realize, okay, something is starting to exceed their capacity to cope. Those are some good indicators. You might have heard of freeze too, when we just kind of shut down. Fawn is one that a lot of people are not aware of. This is the people pleasing. These are the individuals who tend to always go into personalizing things and feel like it's their role to take care of the needs of others at their own detriment. And so this is what I think we call codependent as well. There's other words for it, but this is a very interesting state actually, because, you know, having been in residential, we were able to see all of them, and you'd always have that kid that was the sweetest, most respectful thing, you know, most respectful kid on the unit, and it just didn't match some of the behaviors that we would see or that they were reported for. So the fawn is also one of those defense mechanisms. The way it looks in behavior, you know, besides the aggression, besides the ones that we're very aware of, is denial. You know, when you have someone wanting to hold a client accountable, or hold that person accountable, rather than observing why this person might choose to respond that way or react that way. They might not even be consciously choosing to respond that way. So it's denial of there being a problem is a very common one. They minimize or will say, you know, there's a reason for it, the rationalization. And in therapy, we call these thinking errors, right? But in their mind, it's too much to handle. And so this is a coping mechanism that they use to try to navigate through life. Or projection, blaming it on others. This happens with someone when they're gaslighting, right? A person might come to confront, and all of a sudden they're apologizing, or someone who blames other people. Well, I would have completed this, or I would have a job, but people aren't calling me back, or kind of blaming situations, blaming other people. It's again, it's a defense mechanism, and understanding the reason for it, understanding the role that it takes in survival is really important in order to be able to help the person navigate through that and build up that tolerance to be able to push through and overcome that barrier. Now, the challenges of change, this is where people get stuck because we're human beings. And as humans, we want predictability. We feel comfortable when we know what's going on. This is where we might have some control issues sometimes, where some of you that have your office a certain way and you don't like it when people mess with your stuff, even if it's like a mess, you know where things are, right? You want predictability. It kind of helps things go smoother. Well, we kind of get used to chaos too. And when someone has a lot of trauma in their past, especially as a child, when they're growing up in a situation where there's always a sense of threat, where there's yelling, where there's chaos, that becomes our comfort zone. And it doesn't mean like comfort, like, hot cup of chocolate and warm blanket comforting. It's comfortable as in familiar. And some of you know what I'm talking about when you are at a hotel and it might be the best, beautiful room, but after your vacation, you can't wait to go sleep in your warm, cozy bed. And someone else might be like, that place, that's what you'd rather be at, but it's my bed, it's my room, it's my house, right? This, whenever you have that familiarity, it brings comfort. And then the other piece that we tend to miss or we don't think about is the subconscious programming, is that our thoughts are a result of what is stored in our body as well, and our experiences that we've experienced. This can lead to limitations or rules that we create about how we should, what's possible, what our roles are and things. And because it's subconscious, some people call it unconscious because you're just not conscious of it. It kind of is always running in the background. And unless we're willing to investigate, unless we're willing to observe and explore, that will be the default mode. And 90% of what we do, how we think, the thoughts that go through our head is historical. It comes from the past experiences. It comes from what we've always thought, what we've always seen, what we've always believed, how we've always functioned. And so that's where we get stuck, because the other 10% is maybe things that when we go to a new place or interactions, unless we're using that intentionally, and that's where the mindfulness comes in of being very aware and observing. Now, if we're observing and it's feelings that we don't like to feel and we're used to putting aside and we're triggered and we go into that fight or flight, now we're no longer thinking logically, and it's like this cycle that keeps us stuck. The other piece is when we see sometimes facing something, it shatters our reality. One of the most common things that I hear from, I work a lot with trauma and individuals that realize, man, my parent had anger issues and I need to confront them, and they try to confront them, and the parents like, that never happened. They don't recall because it wasn't that impactful to them. Maybe, well, you needed a whooping or you were acting up and I needed to correct you. Their perception is completely different. And so then the individual kind of gets stuck because they want the other person to validate them or to view their perception. We all have our own perceptions of things and interpretations, and these are the things that can cause us to get stuck. When we start taking responsibility for our parts, so if we realize, okay, if I can set this or do different or reprogram myself, what does that say about all these years I wasted? All this time that I wasted, or I've done this for so long, people view me as that. This happens with anxiety all the time. Some of us like view ourselves as anxious people. And so, it's become a part of our identity. And so navigating through, managing it becomes this like, no, it's mine. We get used to that way of functioning. When we sometimes work through some trauma that no longer is stuck, or it kind of shatters our reality, how we view the world when we're no longer in that hypervigilant state. Think about a relationship maybe that you've had and how you perceive something. If any of you have ever experienced infidelity, And all of a sudden it just, boom, it's this one incident or something that completely shatters what your perception of that relationship was and how difficult and devastating that can be. That is what change brings sometimes, because it's breaking the beliefs, the limitations, all of that maybe we've held on to, a reality that we thought was solid that wasn't changeable, and that can be very scary. The other piece that needs to be considered is the cost. When we change, think about our family of origin, right? When if we're going to be unlike them, unlike all of these what has been carried on through generations, all of a sudden you're no longer like thinking or perceiving the way your family member does. It can cause some conflict, right? Especially when these are like ingrained beliefs or behaviors that they view as part of their identity. And might sound like, wow, this is right, this is wrong. Right and wrong is relative based on experiences as well. So for example, my family's from Mexico, and we have family members over there that we try to maintain a relationship with. But when I was visiting a cousin, I remember one time we went downtown and she got really, really upset at the way I was speaking Spanish. I speak Spanish, it was my first language, but it sounded she called it, don't talk like that. You sound fresa. Fresa is strawberry in Spanish, but what it means is kind of bougie. The word bougie, I guess it would translate to in English. But what was going on is that you can't sound educated in that little barrio, because it was a barrio that was pretty much overtaken by one of the cartels. And so they are observing the behavior. And if you look like an outsider, if you sound like an outsider, you become a target, because they believe you have something that they can take. And so even though here it might be like, it should not be, looked down upon to sound educated, or the language that you use is something that's actually valued, over there it could risk your life, your very well-being. And so it's not about right or wrong, it's about understanding that the same thing that would be right in one context is completely wrong in a different context. Not just wrong when it comes to, it's not about morals. This has to do with the reality of the environment. So understanding that piece is crucial as well, because this sometimes holds us back. Think about how many times you realized you have a family member or a friend that is toxic, and you just cannot break that. You continue, maintaining that relationship, even though it brings grief, even though it brings stress, because they mean something to you. And so that's where our ethics and our values kind of collide, with our survival. So the one thing that we can know about all humans are built, the nervous system, we all have, most of us, I guess, eyeballs, ears, hearts, lungs, all of these things that are basic. And when it comes to functioning, we're wired to survive. We're wired to always try to live. That's like the number one goal. We all want to feel that we matter. We all want to feel valued. And we all want to have a sense of belonging or acceptance. You can call that feeling loved or cared for. Valued could be having a purpose in life, or something that we bring to this world. And all of this is, again, from the self and how we view ourselves and the feeling that we have. Because externally, I work with a lot of people that have like low self-esteem or low self-worth. And all of the information has come from experiences, from people around you that have treated you as if you don't have that worth or that value. And so that, again, it affects our behavior, it affects our mood, it affects how we interact with people, our willingness to risk, all of these things. But if we go to this, as a clinician, as a provider, and starting with the basics, because that's where we can start in saying, how can I help this person feel safe? They're in a triggered state. What can I do to help them feel safe? What can I do to make them feel valued? Hearing goes a long way, listening to what they're saying, trying to get the sense of their perspective. And then that non-judgment, being able to maintain that objective space, right? Perception where they don't feel judged, they feel accepted, is also key in this. It's really hard to do that if we haven't worked on our own stuff. So the other important thing to empower yourself, Number one, I like the definition of power. This is, I can't remember where I heard it, but it really stuck to me because I think this was probably the most impactful in really understanding is the ability to cause an intended effect. A lot of the populations that I have worked with in the past that would be considered high risk view power as control, it's external. So if for example, in a situation where someone gets uses anger, what they're trying to do is control through fear, right? Control others through fear. But the reality is that's all temporary and it doesn't come without a cost. Because if you do that, you lose out on relationships. Sometimes the person isn't scared of you, so you have to step it up. And this can happen where people become violent. I think somebody, Jennifer, raised her hand. Go ahead, Jennifer. I don't know if the audience
Yeah,
is.
let's see. We're working on that. We actually have a quick question too while we're going to grab Jennifer's. If you can put that in the chat box for us, Jennifer, while we're trying to figure out the raise hand here. But oh, maybe not. But really quick, if you don't mind, if we do have a quick question from Neil that just came up in this last slide here. But do you recommend or utilize any non-medical or non-pharmacological treatments for reducing constant hyperarousal? So such as exercise, chanting, yoga, tapping, that sort of thing?
Absolutely. Absolutely. Anything that is body-based is going to be more effective than cognitive based when we're in that state. Because remember, when we're in that state, it's almost like thinking like your body is connected to your emotional brain, and it's like a 2-year-old. It's very reactive and the emotions are very intense, right? So when I think of the emotional brain, if you were any of you that have been around a 2-year-old or had a 2-year-old, they are intense, they are real, they are raw, and it's like all or nothing almost. So you can't reason with a 2-year-old, right? You can't reason with the emotional brain. You have to learn how to soothe it, right? So just like a 2-year-old, you would, hey, come here, you can do this, kind of guide them through. So that's why physical exercise, something like that, is where any of you that have tried to go to the gym every day, what happens? Your body's like a 2-year-old. I don't want to get out of bed. So you have to kind of talk yourself through it, or just come on, we're going, right? And then once you're there, it feels good and you enjoy it after, usually. At some point, they say past the 10-minute mark. But anything that is body-based is going to be helpful in bringing that mind-body connection. My preferred treatment, of course, I do accelerated resolution therapy. Phenomenal tool. I love it. It's completely transformed my own life, and a lot of my clients, because it deals with the memories that are stored, those images that are stored, that are leading to these like pre-conscious responses, because that part of the sympathetic nervous system kicks in right when it kicks in, that you're not able to think straight. This is why when clients are going through like thinking errors and distortions, and they are able to tell you exactly why they function and what they need to do better, but they can't seem to put it into action because the body takes over, because it feels that it's in threat. And now, boom, frontal lobe, higher learning, the logic is offline. And so it feels like you're constantly trying to fight this thing where this overrides, and it becomes frustrating. So a lot of these clients, we call them treatment resistant, because they could sit and like teach your class, right? They know everything. They just can't seem to put it into practice. And that's a good little indicator that they need some somatic approaches. It's body work. It's not a thinking problem. It's a reaction problem. And so this is where these other alternative modalities are more effective at helping them get through that. With accelerated resolution therapy, y'all can read a little bit more about it online at artworksnow.com, which is what I specialize in. It helps to rewire, essentially, memory reconsolidation is what it is. And there's other interventions that do use drugs, like MDMA therapy, that a lot of research is coming up right now on memory reconsolidation. But I prefer art because it doesn't require drugs, and we use eye movements, but we're really working with that part of the brain where you're able to kind of rewire how it perceives things. So hopefully
that being said, what are your thoughts with EMDR in that?
Yeah, absolutely. EMDR is another one that kind of broke through what we knew before about what was possible. I'm not, I'm only familiar with the things that have been shared with me about EMDR. Can absolutely be transformational for people. Um, the main differences, because we also use eye movement with art, is that with art it's very procedural. So rather than having phases, it's I call it kind of like akin to a mental health surgery, where you, from the beginning to the end, you're reprocessing an entire memory. And there's a lot of other aspects that are integrated into this kind of like using Gestalt, IFS approach. Um, Somatic experiencing, there's a pendulation piece, there's the regulation. All of these are integrated into the procedure. So it tends to be, and we use a lot of metaphor. We're really focusing on images. And so it's still, it bypasses all the, the conscious parts. Whereas from my understanding, and some practitioners with the EMDR start kind of with the cognitions, and it's a little bit more free associative, which can be helpful for a lot of folks. But to be fair, the ones who come see me are the ones who didn't do well with EMDR, and find that this other approach, because we're using metaphors rather than hitting the problem face on, we're just really working with the subconscious. It tends to kind of be able to bypass some of those blocks that tend to bring a challenge. So it's really important to know that there is no one size fits all modality. I would be very leery of anyone that says this is the only thing that works for everybody or for everything. I have used art for many different things, but it really is about the individual, what their goal is, what their level of awareness, and what, where they are in the process of change. Because like I said, sudden change, like with art, you can have an event that you process and it goes to a zero within an hour. It's at a level 10 in distress one moment, and then an hour later it's at a level 0. And that shift can be pretty like shattering, right? So if the person isn't already ready or at that place, or maybe they had a pre-trauma level of functioning that they're ready to get back to, it can kind of shake up a lot of things. And so it really is about assessing what is the appropriate tool for what, what is the client's goal in approaching that way. So the next thing, hopefully we get through this more, is to primarily know yourself. Be aware of what your own thoughts, your emotions, your own history, how it impacts your perceptions, how it impacts your interactions, your beliefs about people, about how they should function, or what is appropriate, what is not, what is right, what is wrong. All of those things, really knowing yourself is important, because that's the only way that you're going to be able to set aside those things so that you can fully be open and observe. Learning how to regulate is vital. Knowing when we're starting to get activated. I love that song, that check yourself before you wreck yourself. It's like an old school song. I know it ages me, but it really is great advice, is that if we are not being intentional and being fully ourselves and aware, then that's where things can go in a way that we don't want them to go. So being able to regulate is really important. Intentionally putting your aside your beliefs about the situation, like kind of like a clean slate, so you're able to really observe. Being fully present is important. And what I mean by that is, sometimes when you have someone that you've worked with for a while, our mind tends to start, oh, this person always does this, right? Anything like you're using always, never, things that are like very general, we get stuck because all of a sudden it seems too big. And all we can work on is what is here right now. And we do what is here right now, we can do it well. And that is what's going to help rewire our brain, or help our client rewire their brain, and kind of shift into those changes. Being able to focus on what is, not what if. This is for all my anxious people that tend to always think about what's the worst case scenario. The same mechanisms of the brain that are triggered, that are activated whenever we recall information, something that we actually experienced, are the same mechanisms of the brain that are activated when we fantasize, when we think about something that could happen, or when we're thinking about what is happening, right? So I tell people, if you're going to fantasize, at least make it a good one, because the anxious brain tends to go to the worst possible case scenario, and then the body responds as if that's happening. And before that even happens, you're already feeling defeated. You're already feeling tense. You're already feeling irritated, or you kind of essentially create those feelings in yourself. And so being able to be present is really important, especially as a practitioner, as the one who is providing the service, is because us being present is going to help us re-guide our client to being present as well. One of my favorite quotes is by Neil deGrasse Tyson, and he is a astrophysicist. And he says, one of the greatest challenges in life is knowing enough to think that you're right, but not enough to know you are wrong. Right? That is such a scary word for so many of us. We don't want to be wrong. We have this like perception that somehow somebody could be always right, or we could always, that we can figure things out. And the reality is we don't know much. We really don't, especially when it comes to other people and why they do what they do or what they mean by what they do. And some of you have experienced this before, where maybe there's a certain interaction or something you say that is completely taken out of context, but other people view it as like, nope, I heard what you said. This is what you meant, right? Or some of you like sometimes I, don't, haven't slept, or I didn't get my coffee, or whatever happens, and I misspeak, and part of that can be misinterpreted or misconstrued as to what that means about who you are. And so we got to be cautious about not doing that to other people, and to remember that if 90% of what we do is subconscious, is unconscious, then there might be more going on than even the person knows, right? Much less us. We only know what they share with us and what they tell us, but there's so much more to it. So really being able to recognize and be able to explore what we don't know. It's very easy to go to like, that person is just resistant, they just don't want to change, or they're just a jerk. That is a very simplified answer to a much more complex problem. So always being open to other possibilities, new information, something that we might not have thought about. Some red flags for us is as soon as we start thinking, should, I know, or taking things personal. Those are red flags that we're setting ourselves up for fail to interact or to serve populations that struggle with these things. The shoulds is like the number one bad word. Say anytime you're saying should, that means that you're considering something that isn't, right? It isn't right now. And I don't mean by saying that people, when you're talking about safety is important, right? But when we're starting to say this person should not be doing this, but they are doing that. So what is going on underneath that? What is it that's going on? And that sounds exhausting to really explore. So a lot of us just tend to go to the whole, wow, they just don't want to change, or they're just a jerk. That's just part of their personality. All of these things that we put out that then inhibit growth. It inhibits our ability to learn from them and their ability to grow from where they are. The other piece is the knowing, right? There's so much that we don't know. Yes, I value research, I value evidence, I value science. But even if you speak to one of the most, brilliant of scientists, they will tell you there's so much that we have yet to discover about the brain, about people, about the universe. Is so much unknown. And so just always being in a state of openness and curiosity is really important. And then the personal thing, if what other people do, especially clients or people that you are serving, really hits something in you that triggers you, that's a good indicator that there is some work that you could benefit from doing. Seeing maybe a therapist for yourself, exploring these things, working on some of that awareness and regulation for yourself. Those are some red flags that we want to look out for. Being effective requires us to be able to compartmentalize, separate our stuff, all right, and being competent at working with different cultures, being able to observe. So this isn't from a non-judgmental perspective, being able to regulate. So you have that little meter that helps when you're starting to get trigger activated, and you be able to kind of navigate through it. And then being able to observe where this person is at, right? They might not be able to tell you exactly, but both from what they're sharing, where their beliefs are, their thoughts, and what you're observing, because that's going to help you kind of guide them into direction, kind of viewing. If you've ever been lost and you look around and everything looks overwhelming, every left looks the same as right, these trees look the same all around you, it's a very scary place to be, right? So I say when you're in a place where you just feel lost, try to take a bird's eye view, observe, right? That's the only place that if you're in a difficult terrain, if you had a little way of rising above and being able to look to see what's around you, or using a compass, what direction do we want to go? That's where like ACT, I love ACT therapy because they identify the values, right? It's not about right or wrong. It's like, what value do you have? What direction do you want to move? Right? Is this moving you in that direction or away from that direction? And so this is like having a compass, right? And there's no specific answers. Nobody could ever write a manual of if this, then do that and handle this way. So we have to find a different way, kind of develop a compass of what can guide our interactions. And if we're allowing that, our heart or our intention to guide, then it's going to help us make the decisions in between. Care and compassion is absolutely crucial, not just for others, but for ourselves. A lot of us are terrible at self-criticism. We feel like defeated, and we are critical, and we are like, we just never learn, and it's always going to be this way. And this talk is just, it's destructive. Whatever we are telling ourselves, how we view ourselves, again, when we're able to observe and we're able to sympathize or empathize and acknowledge, hey, that's part of being human, then it allows us to stay out of that fight or flight. Because it feels crappy whenever we, right, really go into that whole failure and did it again, and I can't ever change this, or all of that, all of those thoughts, it yields these feelings in our body that inhibit our growth, that don't help us get to a better place. So it's important to practice that care and the compassion, even objectivity, and viewing how we program, how we interact. The mistakes that we make can be good learning opportunities, or they could be good shaming opportunities that just compound what we're carrying. So that's the piece that we do have some options. When we become aware of it, we can reprogram how we view, and that allows us to kind of let go, not just of things that have been done to us or have affected us, but also of things that we've done to ourselves, or situations we've put ourselves in, or beliefs that we had about ourselves. It's so important to separate, and be fully present, and not just constantly be weighed down by all that. So, okay, I think I made it through. I believe we have a little bit more time, but I just want to stop share. And I know there was some questions that had come up.
Yes. So actually one that just we have that's in there right now, guys, please, if you have additional questions, I know some of you had put in the chat, you were waiting to the end to ask some more questions. First and foremost, fascinating presentation, and you did such a wonderful job, and I can't wait to continue to hear more. But that being said, right now we have one question, and it is, what are the steps to really know how you can check yourself, or, how do you know, to yourself, especially if you feel that everything changes?
Yeah, everything does change, but it's about being aware of your internal state, right? So that window of tolerance that I talked about, if you're one of those people who go from like calm to pissed off, and there's just those two, we got to get a variety in there. This is work that you can do in therapy, of being aware of emotions are not bad. Emotions are there for a reason. They're not there to control us, but they're there to inform us. Kind of like they cannot be a CEO. You can't have happiness, anger, sadness become the CEO in control. They are bad decision makers because they are reactive, they are intense. I mean, think about even the feeling of hunger. Like if I get hungry, I feel like I'm going to die if I don't eat right now. Yeah. But we know, like, I could probably live a couple weeks without food, but it feels that way. And recognizing that feelings are intense and a little extra is the first step. But then learning how to work with them, not against them. A lot of times, especially when there's trauma, we tend to suppress them because we don't want to feel them. And what happens is they start piling up. And then a little thing that happens, kind of like if I was to take my cup and it's full, any little thing, any little drop causes it to overfill. And all of a sudden we're feeling guilty because we overreacted, we overresponded. So being aware, understanding your humanity, that, you're sad because you're human. It's not because you're weak or because it's about being human and coming to grips with that, because to be human is to be vulnerable. And those are the things that sometimes challenge our beliefs. It challenges it. Vulnerability is scary. So kind of being able to explore that, become familiar with feelings, and then increasing the tolerance is going to be crucial to that. I call it ninja skills. Ninjas are so aware of their surroundings, so aware of them that they know, they can feel if someone is behind them to the point that they could respond to it. They're 100% in control. That's where our power comes in, right? So being aware, knowing yourself is important, and the answers are not going to come from outside of you. They're going to be inside of you, within you. So you got to be willing to explore and just work through some of that, become familiar, be curious, and be brave in trying something different and stepping outside of what you normally would do, that comfort zone that keeps you kind of chained to this programming that has been created by the people around you, through no fault of your own. The family you were born into, the community, some of us, like as Hispanic individuals, the race. I used to have these beliefs about what my capacity was, like, my parents had like an elementary education, so college wasn't even a thing on my radar until someone asked me, why not? And I thought, well, I didn't have an answer, and it was that little tiny question by Jeff Davis, who was a waiter at this restaurant, that all of a sudden poked a hole in this reality that I thought was my limitation, right? But that takes time. It takes openness. It takes willingness to explore, willingness to consider other information. And so that's some of the work that you can do with it. It requires some safety though. So that's why therapy could be good. If you find a therapist that you connect with, that you feel safe around, is going to be important. Because as you know that, you're able to then bring in some skills to kind of regulate yourself. And the more you do that, the more you're able to tolerate. And so when you come across a situation, and this is something we build up. I didn't, when I first started residential, if you see someone that's angry and threatening your life, it's normal human response to become defensive. Your heart rate goes up, right? But the more you practice, and I learned this over years of residential treatment, I might have a kid that came up and said, I'm gonna effing kill you. My response was like, well, where are you going to hide this body? Because you got to dig a big old hole. It's got to be 6 feet deep at least, so the smell doesn't permeate. And then what if you have like witnesses? They might come in. I know you don't like jail food. Like the food, you think the food here sucks. Like you should. I heard jail food is really bad. And what just happened? I mean, they would look at me like, this lady's crazy. What is going on with her? Because it's not a typical response, right? The typical response is that humanity, the defensiveness, the protectiveness. And if that came up, what would have happened? Boom, we're triggering each other and we're reinforcing this belief about individuals, about threat. And all of a sudden they realize, lady's weird. She doesn't even know, she doesn't realize what a threat I am. And so they kind of, it throws them off kilter a little bit. And that is that little wedge that you have where they start questioning their reality and their beliefs about what the responses would be, right? And that's when you have influence, the most influence in helping to shatter some of these beliefs.
Well, it's amazing because you kind of transitioned into another question that we got. You almost like gave an example of it, but there was somebody had asked, what do you recommend when working with a youth that is presenting behavioral issues, who minimizes what he does and always justifies his actions? And it was kind of an example of that, but do you have any more to elaborate on with that?
Yeah, absolutely. I mean, I'm not a big fan of labels. Because we tend to, minimizing, justifying, those are all thinking errors, so they're bad. And it really starts affecting how we view the person. And then with that, it brings up certain feelings, right, of the protectiveness, and we lose the ability to observe. We lose that. There are things, and I don't want to minimize trauma. We all have our own experiences of trauma, but when we go through trauma, and I love this one saying that said, if you don't transform it, you transmit it. And this is what happens, is that we get stuck on this reference point about how the world works, about who we are, about our capacity, our identity, our limitations. And then it yields misery. It yields frustration. And especially when you're working with youth, because boy, youth they know how to hit you right in the jugular, right? And so when I tell people, if you have certain buttons, get rid of the buttons so people don't push them. And that means do your work so it doesn't trigger you, because you're going to have so much more impact when you're able to observe, when you're able to respond rather than react. And that requires intentional work on, our stuff. Like realizing, yeah, this came from this, but it doesn't have to be true. And I can break through this and think differently. And it's going to, somebody who's justifying, who's minimizing, does that let you know? They're avoiding. Why? Because it probably feels crappy. They just, it's a defense mechanism that they learn, and they're dang good at it. So I might just be like, oh, well, that's interesting perception, but you got to be intentional about how you bring in challenges. I had a kid who, I always share this story because he's, huge transformations. But when he first came, he had been abandoned at an orphanage from the country that he came from. He had been adopted. His name had been changed, and he was arrested from the time he was 8. He was just a bad kid. So he let me know, I'm just a bad kid. I'm evil, and would try to do constantly things that reinforce that. And so it had to take the opposite approach, of like, oh, here's the continuum. Are you here? Or are you like, this is good, this is evil? Oh, I'm definitely here. And it was just observing information. If I go on the unit and he's just walking by, I'm like, hey, come here. You didn't even cuss that lady out. You just walked by her and you didn't cuss her out. What happened? Why would I cuss her out? Like, she didn't do anything to me. I'm like, oh, you have like values and ethics. I don't think you're this evil, because this person wouldn't even need a reason to cuss them out. So you got to be at least right here, right? There's no way you're down here. And it's just presenting new evidence that challenges this belief that they have about themselves, one step at a time, until all of a sudden they're questioning their own belief about themselves and their capacity. And this is the challenge when we put labels, and we see a kid and we get frustrated because energetically, emotionally, we reinforce that belief that there's shame, that they're guilt, that they're manipulative. And then we're very shocked when they stay stuck in this behavior of that is shaming, that is, manipulative. But we're inadvertently continuing to feed that program and reinforce that. And that leads to frustration. It leads to burnout. It leads to feeling powerless. And so this is the power of when we do our own work and we're able to observe. And don't get me wrong, of course it's difficult. Of course it's challenging. I'm very grateful of having gone into the mental health field so early on, because I went through all that stuff where you get frustrated and you leave work crying and you're heartbroken because of the decisions people make. I've seen kids who have died by suicide, died by homicide, by police. It's absolutely heartbreaking. But when we're able to see beyond like our own limitations and able to recognize why they think the way they do, why they continue doing what they're doing, then we're able to start helping set this new possibility, with our interactions, with our words, all of those things. And so that's really important when we do this work.
That's amazing. And honestly, when you said throw away the buttons, I was like, oof, there we go. And your ability to segue into our next questions is amazing, because actually one of the next ones we had was, when you do display intense emotions in front of our teams, clients, how do you quickly recover yourself in that moment? Do you have any strategies for that if that tends to happen?
Absolutely. That isn't, we always believe crisis is opportunity, right? Oh, you just displayed your humanity. It's embarrassing. We were all human, though. We're all faulty. So learn how to embrace your own humanity and be honest with your own humanity. I can't tell you the power of, nobody is a perfect parent, right? But I went through, and I'm getting better at my interactions with my own kids, but I'm telling you, and y'all know, I had endless patience I had kids who had committed murder. I had kids who had done these worst things. And I'd go home and my kids spill drink and I'm like, oh, I cannot believe this. That's part of being human, right? So acknowledging that and recognizing that and having some self-compassion is going to be so important. But those are also the moments where you teach these teens how to be human, right? That you can make a mistake and you can make amends and you can come back and say, you know what? That was not okay. I got very upset. I lost my cool. I yelled, and it just was not okay. And it's not anything that you deserved. And the kid might say, well, I was doing this wrong. Yeah, but everybody makes mistakes. And me losing my cool did not help you feel safe. And so coming in and acknowledging being able to say, you know what, I think next time I'll be more mindful of how I'm feeling so that I'm able to protect our relationship, right? So I don't want to get to this point. So these are the things that I'm going to do, A, B, C. Our behaviors are 1,000 times more impactful than our words to these kids. You can say everything, but it's this much goes through, especially when someone is in a state of survival. It's what you do and how you manage through things that is gonna leave long-term impacts on these kids' lives. And so it's so important to recognize the value and just the power of those interactions.
Mm-hmm. Well, and I love that answer. Do you have any suggestions? Are there any methods, or even I wonder if there's like formalized ways to do this? I was curious myself, but suggestions on how to uncover hidden or implicit bias to build, your consciousness about that, and then taking that intentional action to combat it.
Yeah. I love, there's a lot of research on meditation, on mindfulness, but I could tell you, having worked with complex trauma, meditation is like guru level. So I really applaud those of you that can sit and like clear your mind. I'm still working on it, just being able to sit in silence. My brain goes to like, what do you need at Costco? Make the list. Oh, did you do this presentation? You have, it just starts going. Thankfully, most of the stuff is like productive that I need to do. But there are many ways. Meditation is really just a form of being aware, right? And being present and mindful. You could do this through everything that you do, from how you eat to, being mindful of what you put in your mouth, what you're saying, what you're feeling, even the breeze, the fan behind me, I can feel that sometimes. Just always being present, because that's where we have our ability to start then observing what we're doing, what we're feeling. Practicing that every day is going to help expand your awareness. And then you're able to be more intentional. So you're able to kind of catch yourself before you get to that point of disconnecting, right? Then you're able to kind of come back down and the more you do that, the more you're able to tolerate, and you'll start improving this. When you have a reaction, rather than externalizing, and this is where our number one mistake is, kind of putting our attention on what so-and-so needs to do. If so-and-so wasn't such a jerk at work, I would be okay with my job. Or if, my supervisor, and it's all valid frustrations, but it kind of takes all your energy, it siphons all your energy, and you're left with no power and control, right? So focusing internally, rather than that person's a jerk and triggers me, just reframing that to, why am I triggered when that person struggles, right? Why am I triggered by that person's way of living or functioning or interacting, and being curious about our response to that. Now, if that person's holding a knife to you, well, yeah, you're supposed to be triggered, right? But most of the time I find we're not in a state of threat. Our life is not at a threat. It's not, and we feel that way, right? Human beings are the only ones that respond to like emotional threat at the same level as physical threat, right? The fight and the flight response. And so slowing down and kind of telling your body, chill out, homie, like, we're okay. Let's just observe and see what's going on before you get all riled up. So that self-talk is so important. You might feel like you're losing it, but you're actually going to be a lot more effective. My personal choice is humor, right? This is why, like, humor breaks up that tension. Humor, if you're good at dad jokes, throwing in that dad joke, sometimes you got to tell yourself a joke, and being aware, having inside jokes with colleagues is really good. I know that this is kind of not mean, we love the kids, right? But in our mind, when I worked in RTC with some of the colleagues that I had that were close, we had these like imaginal darts that you could like, you hit a person and they just like are out. And so we had this thing like of just visualizing that, and then you come back and you're able to, all right, let me see how I'm really going to approach this. Because, it's frowned upon to do that in Arizona. You can't just dart people randomly. It's not, I think it might be illegal.
I don't know if it's just an Arizona thing, but yeah.
Yeah, maybe Arizona, maybe other places. But in your mind, you could do anything, whatever it is, to like disempower that threat, right? To realize they're not a threat. We're okay. But with the colleagues, we knew when they had a rough day, because it would be like, hey man, how many darts you have left? I'm out. I need to borrow some. We knew they were having a bad day, right? Or others, like, I still got 3. That's a pretty good day. No one knew what we're talking about. It doesn't make sense, but it's just developing our own internal toolbox that you can go to and like I said, humor works great. Practicing that and because it's hard for the nervous system to think you're in a threat when you're cracking up or when you're laughing.
Yeah.
Right? So that can make a huge impact.
Wonderful. And I I love that. That one's going to stick with me, I think.
Yeah.
But Sonia asked, do you feel gender and or hormones play a certain role in human emotions? Is there anything to that you'd like to speak to in regards to this?
Oh, absolutely. Absolutely. Y'all know. I mean, I told my kid, like, honey, I'm sorry, like 6th through 8th grade is just going to suck. I mean, it's just going to suck. You feel awkward in your body. You have all these kind of like emotions coming. It's just part of being human, right? And I have to remember that too, when my 13-year-old is being 13, that I have to just take a breath and remember what a jerk I was at 13, right? Because it's just part of like human development. And I heard that we go through like that next puberty later on. I'm really like not looking forward to it. That when we go through like menopause, but absolutely physical health impacts our mood. It impacts our functioning, but vice versa. Mental health impacts our physical healing as well. They're all interconnected. I work with the mind, and if it's a body thing, then I send them to somebody who knows more about medical, right, and the hormonal stuff, because those are always considerations to be made. And that's why I am a big fan of like collaborative care, integrated care, because there's no, we're a system that everything impacts, right, each other. And so absolutely those things need to be considered.
Yeah. Now this one, it might be, we're going to put you on the spot for a quick sec. Do you have a preference? Which do you consider better to train in EMDR or art?
I mean, yeah, you're of course biased, but to be fair, I never got trained in EMDR. I've never done EMDR. There's a lot of trainings out there that I would love to take that I've learned about. They're fascinating. I think that every modality has value to bring to our field. And I think when we get into this mode of saying better, it risks us kind of pigeonholing us into this limitation that, I do sand tray therapy as well. I love sand tray, but there's a lot of people who you wouldn't catch them dead playing with toys, right? They wouldn't, well, of course, because they'd be dead, but it's not something they would want to do. Anything that's subconscious. In terms of, what I have heard from both clients and from clinicians, whereas EMDR does a very beautiful job of really going into the mechanisms of the intervention, how the brain works, and all of this, like kind of the background of it. With art, our 3-day training is very intense, and we're teaching you how to do the procedure. So it's more like how to facilitate this, because it is a 1-hour intervention. My preference too, in terms of, I'm kind of a person that just likes to go in and get it and be done. And that's not always the best intervention. It's great for, like you have a professional, like if I had a doctor or a dentist or somebody who is busy and something happened and, they just want to get back to pre-level of functioning, they'll come see me for an art session. Come in, bam, they're done. It's reconciled. They're back to previous level of functioning. Works great. Complex trauma, which I work with a lot, might not be able to handle that, right? So something a little bit slower might work for them. I did some like somatic experiencing as well, and that pendulation piece where you're slowly kind of working with the nervous system might be what somebody else needs. What I love about art is I'm a very creative person already by nature. I just make up stuff in my head all the time. So it just really speaks well to me. And so that's what I love about it, is its playful nature. if we're people who like to move quickly, some people would say, they've seen clients for like years. I'm not a person that wants to see you for like, that's what you got friends for, right? I mean, I do see some with more complex issues, but for the most part, I love movement. I love to see results. And that's what I love about art is I'll have an individual who comes, and after we able to get through something, they're able to function. My personal experience, and this could be part of my bias too, is, that's what had transformed my life. Even through COVID, I have two sisters who are ICU nurses, and, in Phoenix, we're like one of the hotspots worldwide. Well, in July of last year, I lost my father to COVID, and it was very traumatic. It was horrific because, when you watch somebody, and we weren't able to go into the hospital, but he was on the first floor, so we had a window to the street, so we were able to sit by his window, which was such a blessing to be able to still be present and talk to him and see him and, communicate with him. But it was also excruciatingly painful to see how this disease slowly, it's almost like watching someone get waterboarded, because they can't catch a breath. And so that's, to make a decision where your love for them is so great that you're willing to pray for death. I mean, that's a very deep, very difficult place to be. And I can tell you, going through that and then coming back, where my sisters, you guys knew that we were short staffed at the hospital, and they're working with, individuals who are losing loved ones, their colleagues. So not just patients, and not knowing what to do to help these patients, and seeing people that should not die. It doesn't make sense. And yet they do. But not just that, but colleagues. My sister had a doctor who died by suicide the same week my father passed, that she was close to, had, colleagues who lost parents, who lost loved ones, who had 2, 3, multiple, family members that were lost. And so talk about constant triggering. And I can tell you without a doubt that if I didn't have art, there's no way I could have held the space that I did for the individuals that were suffering, that needed help at that time, that I could have helped my sisters be able to continue providing these much needed services. I have and my sister did give me the permission to share that, because I've shared her story before. She hated therapy. Like, she thought people are just stupid. They just need to get over it. We always had, that's part of a Hispanic thing. Yes, we have 2 diagnoses. It's está loco or they're okay, right? It's like this extreme in my family. And so my sister was in that. There was no mental health. It just, you get over it, and didn't really believe in what I do. And she got to a place where she could not function, and finally said, okay, fine, I'll let you art me. We normally would never practice. We don't practice, of course, ethically. In case anybody of the board members are there, I don't practice on family. But this case, it was like about a survival thing. She refused to go see anyone, was not functioning, and begged me, hey, do this. And it really is that procedural, right? Where we're able to get through the procedure. And she was able to go back to work. She was able to continue functioning and able to help others. And I'm telling you, to be able to get through something like that and still hold the space and be there for others and see their suffering and connect to their pain and not fall apart, rather be able to help them navigate through it. There's nothing more beautiful. That's what connects us, that just kind of breaks all barriers. So that is my piece with art, is it's, it's quick, it's powerful. And for anyone who doesn't have the time to go to weekly sessions for a year, 2 years, explore. It's a very brief, very powerful intervention. So of course I'm a little biased to it, because just, the way I think and how I view my role as a healer as well.
Yeah. Well, wow. I just want to say thank you. You've a wealth of knowledge, and we've had, I'm reading 35 at least comments just about the takeaways that folks are having from your presentation. So I just thank you again. And I know, with everyone muted and no videos and things, I'm just going to clap for you, because that was fantastic.
Thank you.
So we just want to give you a big thank you again. I know we're running short on time here. We're just about at it here. And people have meetings and things like that to go to. So we just want to say thank you again, everybody. Final reminder. Ooh, I like it. Somebody put clapping in the chat. That works nicely.
Thank you.
Glad I wasn't alone in that. Just a reminder.
Thank you guys for helping. Thank you guys for having me, because I know I'd never met anyone at Aurora, so I got this opportunity. I think I turned in my presentation last night, so I'm like, they probably think I'm a flake, but I will be there.
No. Well, thank you again. And folks, please check out Lighthouse Psychiatry. They're a great resource. They're in the East Valley. We're very proud to partner with them and just do a wonderful job. And a reminder for everybody, if you have any questions, again, about Lighthouse Psychiatry, the services they provide, they have a lot of great ones. If you have any questions about Aurora or inpatient or outpatient levels of care, please reach out. We'd be happy to answer those for you, do some presentations for your workplace. And lastly, again, we appreciate your patience with the CEUs. We had about 325 people on the Zoom today, so creating those individually can take some time. So again, if you haven't received it though within 7 days, so this time next week, reach on out to us and we'll be sure that we get one right on over to you. And otherwise, have a wonderful rest of your week, everyone. We appreciate you joining us today.
Thank you.
All righty.
Bye.
Bye, guys.